So I want to pause for a moment and tell you the two things that I always regret saying to families. The first thing I regret is that your child has minimal change in nephrotic syndrome and is going to respond to prednisone. But unfortunately, I have to weigh what I say to 95% of people where it will not be focal sclerosis versus the 5% where it may be. And so I still err in terms of trying to be positive in terms of prediction, which doesn't endear me to the 5% where the prediction was wrong. The other thing is that we can read all the literature we like, we can be as clever as we like, and then a patient comes along with a condition that's inherited where it's not supposed to recur, and it does recur. And although we understand so much now about the podocytes and all the genes and everything, we still have to think maybe there's a second factor that's working together with this genetic abnormality. So thanks to Dr. Pradhan and the team at the Children's Hospital, who did something that I personally thought was absolutely crazy. They began to do plasmapheresis on our patients with recurrent nephrotic syndrome the minute they saw protein in the urine. The day they saw protein in the urine, they started doing intensive, repeated plasmapheresis. And in the case of these patients and others, the proteinuria remitted, and the patients are now doing extremely well. So that's another clue for us that we have not been able to think through completely at this time. So I think that what I suppose I hope to have done is not to cause anxiety, but to raise points for questions. And if there are any questions, please. Yes, sir.
Since, if I understand it, FSGS don't occur to the
Yes, nephrotic syndrome in general has a 2-to-1 ratio, yeah. I don't know the answer to that. I do believe that one day we will have some evidence that some cases of FSGS may be caused by or initiated by certain viruses. I mean, we didn't know what hepatitis was all about, and now we know there are many different viruses. And I just want to say that a lady asked a question about multiple sclerosis, and the value of having a registry which has a comprehensive set of questions is that something like this can be answered. So, for example, she didn't know that I've had a patient with multiple sclerosis and FSGS at about 12 years of age. And I didn't know that she had a family history of multiple sclerosis. And that's been shown to be true for lupus, for example, that by taking careful family histories, you find that there are people with arthritis or people with low platelet counts, and so on, and something starts to come together. Yes, sir? Yes, ma'am?
That might account for the FSGS coming back and the transplant.
Yeah, you see, when one has a sort of theory like this, it's got to sort of be unifying. So how do you account for it in a 3-year-old child, you see? Except as a virus, I mean, not sexually transmitted virus. But the truth is, the amount that we know at this time in history, I believe, is infinitely greater, infinitely smaller than the amount that we don't know about anything. So we have to keep our minds open. Yes, ma'am?
Yes, I was wondering, how do you, because of the recurrence of FSGS, how do you decide what child is a good candidate for a transplant or not? You know, if a child is doing well on dialysis, relatively stable, how do you make that decision to transplant or not?
Well, that's the subject of a very long discussion between the family and the child and the doctors. We still believe that transplant is a better option than chronic dialysis, especially for children. And I think that we still err at this time in favor of trying the transplant and seeing what will happen, because we can't predict what's going to happen.
Do you wait a period of time? That's sort of standard.
Well, again, you know, it's tempting to think that one should wait a period of time. There certainly are conditions where you like lupus, like hemolytic uremic syndrome, where one should wait. But even there, one doesn't exactly know what one is waiting for. It's difficult. It's very difficult.
Now, do you do plasmapheresis, is one last question, before the transplant, or is that just you typically do it just after?
Madura, we haven't done it before, have we?
We personally haven't, but there clearly are reports of plasmapheresis before the transplant in high-risk patients. And the results are varied. Some of those patients did not recur, and some who underwent plasmapheresis before did recur. There are very few case reports. So,
We're not sure yet.
something we can consider in high-risk patients.
Yes, ma'am.
So the plasmapheresis is cleansing? Is it a cleansing?
So the question is the plasmapheresis cleansing? So there is good evidence from very good studies that there is a circulating factor that's causing some damage to the membrane. But you think of something like plasmapheresis, and you think there's a circulating factor. How do we know how much plasmapheresis we should do? How do we know how often we should do it? How do we know if we've cleared everything? But the theory is that we're clearing something.
Can I test?
Sure.
Is it dangerous
Plasmapheresis?
procedure? I mean, what are
Every time you walk into a doctor's office, even to say hello, and you shake his hands, you put yourself at danger, at risk. Yes, it is potentially dangerous.
It is.
Thank you very much.